Hello, this is a virtual pathology specimen of an epidermal cyst of the skin, and we are looking here at the overlying ellipse of skin that has been excised together with this underlying cyst. This side view shows the epidermis and a little bit of the dermis, and then we have the cyst arising deep to this. The cyst is well circumscribed and the outer wall is whitish in color. In the fresh specimen in the intact cyst, it is usually filled with whitish or grayish pulpy material, and sometimes the material can appear cheesy, and it's usually quite foul-smelling. In this particular specimen, the material has been removed, so we can see some residual grayish flaky material lining the cyst wall. Let's learn a bit more about epidermal cyst. Epidermal cyst is also called epidermoid cyst, epidermal inclusion cyst, and infundibular cyst. Usually it is clinically diagnosed as a sebaceous cyst, which is actually a misnomer because there are no sebaceous glands within the cyst wall microscopically. This cyst is derived from the hair follicular infundibulum, which is the most superficial part of the hair follicle, and it is usually located in the dermis. Clinically, this cyst occurs most commonly in the face and neck region, also in the trunk and genitalia. It is usually seen as a dome-shaped, mobile nodule, and sometimes there is a bluish tinge. The skin surface may have a central small opening, a dot-like opening known as a punctum, which then leads to the underlying cyst, and it can sometimes be inflamed and appear red and be tender, and also occasionally the punctum may extrude cheesy or foul-smelling material which comes from the cyst contents. So here are some of the gross features. Here is one example of an ellipse of skin with this domed or raised area, and you can see here a small central opening, which is the punctum. This is again the outer wall of the cyst with the overlying skin, and you can see that it is very well circumscribed. It appears grayish and pearly here. And this is a cut surface, and you can see the skin, and this cyst is actually full of this whitish, grayish, flaky or pulpy material. Microscopically, we can see that this is the overlying epidermis, and this is an intact cyst in the dermis. The cyst is lined by stratified squamous epithelium, as you can see here, and there is a granular layer present, very similar to what we see in the epidermis. And within the cyst lumen, there is this lamellated flakes of keratinous material. There will be a separate video describing the microscopic features using a virtual microscopy slide. This is a different example where we can actually see the punctum that opens into the epidermis, and we have here the underlying epidermal cyst. And this is another example where we can see that there is an area of inflammation just adjacent to the cyst wall. We can see the cyst lining here. This inflammation is composed of lymphocytes and multinucleated foreign body type giant cells. Sometimes there can be acute inflammation as well, and even abscess formation. Here, if you look carefully, we can see a few little keratin flakes in the surrounding stroma, and this is the ruptured cyst contents that has gone into the surrounding stroma and inciting an inflammatory and foreign body giant cell reaction. The virtual pathology specimen, as well as these annotated gross and microscopic pictures, are taken from our free online pathology resource Pathweb. You can access it through the link which is in the video description, and registration is completely free. In summary, this is a virtual pathology specimen that is taken from our virtual pathology museum, and this is an example of an epidermal cyst where we can see the overlying skin, the dermis, and we have a very well circumscribed unilocular cyst within the dermis that contains some pulpy gray material. Epidermal cysts are very common and they arise from the infundibular portion of the hair follicle. Thank you.